Hi, today we're going to talk about assistive devices and what are the best heights and how to fit somebody with an assistive device. Walkers are one of the main questions that we get about how to help somebody when using a walker. So I'm going to go over a few tips for people who have loved ones that use walkers on a regular basis so that they can make sure that they're fitting properly. So here I have a pretty standard forward-wheeled walker. The wheels on the front. This particular one, sometimes they'll have tennis balls on the back. This one has kind of these little plastic skis, and you can get these typically at your local pharmacy, but they just kind of help with the wear and tear on carpeting, and they don't wear out nearly as fast as a tennis ball will, although they make tennis balls that are made for walkers now. So when we're talking about fitting a walker for somebody, we want to make sure that we're taking a couple of things into account. Some of our patients who have a tendency to hunch over their walker, sometimes they think, well, what we need to do is raise the height of the walker. I'll get into fitting the height for a walker for somebody who does that on a regular basis here in just a minute. But we're going to talk about, just generally speaking, if you have somebody who's new using a walker, what ways they should, what's the proper use of it and how to make sure that it fits properly. Okay, so if I'm standing up straight up and down, when I pull this walker towards me, normally I should be inside the walker itself. This is ideal so that the back legs of the walker are kind of going right down the middle of my leg. So when I'm standing up tall, the walker should hit me right about the middle part of my wrist if my arms are completely extended. This walker is actually just a tiny bit short for me, and so what you'll do is you'll just come down here to these bottom nodules and raise them up a notch. Once you do that, then you kind of re-look at it again. Sometimes it's not always perfect, but this hits me pretty close. I don't know that I would go much higher than this. It just kind of depends on where the comfort level is. So that when I grab hold of the grips here on this side, I have a slight bend in the elbow. Now, with these particular wheels, you'll notice that the wheels are to the inside of the rectangle that this makes up. And so the reason why we did that with this particular walker is because for some people who have a house that was built in the 70s and may not have wide doors, this is the only way this walker will get through a doorway. Whereas for other people, more recent doorways seem to be a little bit wider. They're kind of made for a better access. The wheels will be to the outside. That helps to increase stability. So just if anybody had a question about whether or not the wheels should be to the inside or the outside, it's really about access. If we can use the walker in every room in the house, then having the wheels to the inside might benefit that. Otherwise, it might not. Okay, so let's go back to the initial question that we asked about. If we have somebody who you see walking and they kind of do one of these, leaned over their walker, a lot of times the natural inclination is to raise this up higher, when in all actuality, the reason why a lot of people use a walker out in front of them like this is primarily because they're wanting to increase the stability. They've had multiple falls, they have a fear of another fall, and so they want to avoid that from happening again. So they increase their base of support by getting this walker way out in front of them. The other thing that it does is allows them to lock their arms out completely and basically lean on the walker, so they're not having to bear as much weight through their legs. And there's not as much drag. The problem is that sometimes these walkers get out in front of them. They scoot a little bit faster than they would like, and they'll have a fall related to that. So encouraging that loved one or person you're caring for to walk inside that walker and try to increase their posture. Now, there are some cases in which, standing up straight just isn't possible. They have increased kyphosis at the upper spine or in the thoracic spine. Some of them have severe low back pain and they cannot extend completely. And in those cases, then, from a practical standpoint, you do what works best for them. So now we have the right height of the walker. Now let's talk about how to use it. Some people you'll see when they're using the walker, they'll just push it along and walk normal. What's called a step-through gait, or normal walking is where one foot passes the other. And then if somebody has an injury or pain, oftentimes we'll sometimes recommend what's called a step-two, where if I've got a sore right hip, this hip is hurting me, I'm going to push the walker forward, I'm going to step with that sore foot, I'm going to lean more on the walker and take a step. Then the walker, sore leg, then good leg. Walker, sore leg, then the good leg. Okay? When using this type of gait pattern, it does slow things down, but it does help to really unload some weight off of the leg. If you've got somebody who's having increased knee pain or hip pain, it's the first thing I go to is like, let's unload the pressure off of that leg for a while and see if some things resolve on their own. If it's an ongoing issue, then there's some other interventions that we can do. But that's ideal for what to use, or the pattern to use for a walker. So now when transferring from using a walker, transferring from standing to sitting or sitting to standing using a walker, what we always recommend is, you'll see some people, they'll come up to a chair and they'll just push the walker off and they'll go to sit down. Sometimes they will literally fall into the chair. What we always recommend for folks is to walk nice and close to the chair, turn all the way around, concentrate on keeping the walker with them, keeping the legs so they feel it on the back of feeling the chair on the back of their legs. The walker is all the way back, and then they reach back with one hand, letting themselves down. With the walker in front of them, sometimes they're eager to pull on the walker and try to stand up using the walker. We try to discourage that, where we can push up from the chair, then grab hold of the walker once you're in standing, and go from there. There have been circumstances in which I've literally had to keep the walker back away from the patient while they got into standing, because they really insisted on grabbing onto that walker and pulling on it, and it pulled, it didn't really work very well. So that's one option to do. The hard part about using a walker on a regular basis in a house sometimes is you have close quarters, and so they'll refuse to use it in the house. So sometimes we recommend, if they're just not going to use it or be able to use it because of the physical situation, we recommend using a cane. And that'll be in our next video on how to use a cane and how to measure and fit it.